Good morning, guys, and welcome to Unique Not Different with me, Shamla. And today, as we continue the start of the new year, we are going to talk about physical health. And with me, I have neurologist Dr. Nicholas Maraj, and he is here to talk about physical health, brain health, and so on, and how we can do things to improve or prevent problems of physical health throughout this year. So good morning, Dr. Maraj. It's really nice having you back again on my segment. How are you doing? Happy New Year.
Happy New Year, Shamla. It's always a pleasure to be here with you. Always, always wonderful.
Thank you. I could safely say you're my in-house doctor.
Not a problem. Not a problem. Anytime.
So, okay, so start of the new year, people always think about physical health, what they're going to do to improve their physical health, right? And then sometimes it tends to fall apart during the year. So what are some things persons could do to, simple things to upkeep or improve their physical health?
All right. So I guess by definition, physical health is like the well-being of your entire body. It encompasses all the systems of the body working optimally together in union. For example, the cardiovascular system, pumping blood around the body, the respiratory system working well to have gases come in, go out, your gastrointestinal tract, absorbing food, getting rid of waste, and obviously my favorite system, the neurological system, controlling everything in the body. So what's essentially important for good physical health? We kind of all understand these, but just to kind of put them in order, one would be proper diet, exercise, being socially active, taking care of your mental health and taking care of emotional health as well. So if we had to take the biggest one, your diet. The most important thing is to eat a well-balanced diet. That would be fresh fruits, vegetables, about 5 servings of that, low in carbohydrates, low in fats, moderate amount of protein, high in vitamins and minerals, with drinking alcohol in moderation. 2 units a day for men, 1 unit a day for women. Yeah, a unit is basically like one beer, one shot of whiskey, one glass of wine. So two allowed per day for males, one allowed per day for females. Just because
They're just to wake you up. They're just to wake up the body and the mind. I'm
do a lot of it. Yes, it does. If you smoke, stop smoking. That's definitely really bad for your physical health. And I guess the trouble with trying to eat very well and healthy these days is it's pretty expensive to do.
Yes, very expensive. So in terms of like, okay, so there's a person who are physically active throughout the day in terms of their jobs, etc. And there are persons who tend to be sedentary, sitting, right? Is there a difference that in terms of what you just described or discussed in terms of, okay, eating patterns, etc.?
That's 100% correct. So for example, people who are more physically active, like let's say a construction worker, will have a higher calorie demand than somebody who's less physically active, like a doctor who's sitting down and talking to patients all day. Significantly different.
Right.
One big thing that they see in health as well too is I think a lot of workstations are moving away from this, from actually physically sitting down for most of the day and actually standing up. Having the workstation being more elevated so that people don't sit physically actually contributes significantly to a better state of health and not.
So like persons like me who always sit there, we don't have a choice, right? And then, well, me, I tend to move, yeah? But then there are persons who are very solid and not cannot move unless somebody move them, right? How, in terms of what would you suggest in terms of a diet?
So diets for those people would be obviously based on whether they have any other medical issues, for example, diabetes, high blood pressure, high cholesterol, and it obviously be based towards having a negative calorie balance so that you lose some of that excess weight there. And if you're saying that it is, and you're not trying to put on extra, so trying to keep your balance. If you're in a good state of health, you're trying to keep it balanced, and if you're not optimum state of health, you're trying to either take away some of those calories or add some of those calories, depending on how it is.
For us to be productive throughout the year, right? Our minds have to be, our brains have to be constantly thinking. And we live in a very dynamic world where we have multiple things. We never think in one thing at once, right? So definitely our brain have to be on point. What are some rule of thumbs, given your specialty, that we can do to improve our brain health?
Really interesting things. So you want to make sure it's pretty much just like physical health in general. Your brain works with pipes carrying blood up to it. It functions with the electrical activity inside of it. So being physically active sends more blood to your brain, gets rid of all the toxic waste products. Eating a proper balanced diet. There's no particular set of foods that make your brain more active or not active. You know, you hear about all these things about eating fish more or having high iodine or making sure and take your ginkgo or your Neurosan or your B12. I mean, those things are okay if you take them not in excessive quantities and if they're not significantly financially burdening you to take them. There's no significant increased advantage of having those though from a dietary point of view. Definitely not overdoing it with alcohol and not smoking contributes to those things. Being physically active. And one of the things that we don't really take into consideration from your brain health is socialization and being in a state of mental good health. So humans are social animals. We really, really depend on interactions with other people, good quality interactions. So if you notice during COVID, well, from in my job, I noticed during COVID, a lot of people were separated from each other, couldn't interact with each other, and that contributed to a lot of dysfunction in their physical, in their mental, physical health, as well as their brain health. People became a higher propensity to have dementia, inability to use their cognitive faculties well, and it was pretty sad. And once people came back out of that, they started recovering pretty well. So it just tells you how important socialization, having good connections with people, whether it's just be friends, relatives, co-workers, both physical interaction as well as just, I guess, Zoom or virtual interactions.
Having stimulating, not just any and anybody, but having stimulating conversation with persons, but stimulative brain.
You're very correct. You're very correct.
Right.
Very, very correct.
I believe in that. Okay, so persons tend to have, family doctors and so on. When you go to your family doctor, right? Sometimes you just go for a general checkup. What are some common questions persons should ask about, your doctor in terms of trying to get to, okay, is there something to get to the root of any problem of the fact, their instinct telling them something is off?
So when people typically know their body, and if their body's changed in any way, they know that something's kind of off. The typical things would be to, when you go to your family doctor, make sure that they check your blood pressure, check your sugars, make sure you're not, because diabetes and high blood pressure is probably the most common diseases we have in this country because of our lovely food that we love to eat and our very relatively sedentary lifestyle. So that would be super important. To always talk to your doctor about whether you're in the proper weight category, your BMI, your body mass index, so that you could identify whether you need to be a bit more physically active, control your diet a little bit better. Always important to talk to your doctor, example, if you're above certain age groups for certain types of things, for example, like prostate disease for men, breast health for women, cervical health for women, especially if you have a risk factor and a family history of cancer. That's important. People tend to shy away from mental health as well. So if anybody in your family has had an issue with their mental health or addiction or those types of things, that's things to bring up to your doctor as well, so that you kind of nip those in the bud or at least have some idea of how to tackle those things before they become trouble.
And in closing, right, what advice in general, as a neurologist, would you give a person or somebody who is in practice, right? Given your experience, your patient, what a patient and so on, what advice would you give someone in terms of, doing things to prevent all those things, all those problems, and in terms of visiting doctor, because people tend to shy away from visiting doctors?
I guess the best advice I could give to some of my colleagues would be to to be as open and understanding with their patients as possible. Give them some time to allow them to talk to you, hear them. Because most of the time when you actually properly listen to a patient, they tell you the problems and they tell you the full diagnosis within, what, like 90-95% of the time, without having to run a whole set of unnecessary expensive tests and stuff. So biggest thing, listen to your patients. They tell you what's wrong with you.
Dr. Nicholas Maraj, I want to say thank you so much, and I will definitely have you back throughout the year, to focus on neurology and neurological types of problems, right? So thank you for your time, and thank you for sharing your knowledge. And Happy New Year again. I wishing you all the best for this year. May you enter this year with plenty of success, So again, thank you. And guys, with that being said, I want to say thank you so much for tuning in to this week's segment of Unique Not Different. Until next week, I always say, be good, do good. Bye, guys.
Bye, Shabba. Happy New Year. All the best.